My name is Mary Ashinyo. I'm a public health doctor in health policy planning and management, and I'm also a Mandela Washington Fellow. So I think that in the history of policy reforms, it is clear that the gains that we have made right now in our health indicators across board came about as a result of different stakeholders coming together from several sectors to put their heads together and see where there could be some reform, taking into consideration the current political environment and the context in which we operate. So for me, as a health policy person, it's a golden opportunity for me to see and experience how several stakeholders are engaging, taking into consideration the public health benefits of drug policy reforms. Okay, so I think that the general consensus of all the participants is that yes, it is important to have drug policy reforms. There should be, however, a clear demarcation. We are not saying we should legalize drugs or we should allow people to traffic drugs. We are saying that those who possess drugs for personal use should be helped rather than being punished. So it is clear that currently we lay more emphasis on the criminal aspects rather than the public health significance, first to the individual and also to society. So this reform meeting is trying to focus on the need to have more public health talk about drug policies. How can we focus more on harm reduction interventions? How can we focus more on supply and demand reduction interventions? How can we come up with needle replacement interventions, for instance? Because it is not, drug issues are not isolated. They are also interacting with other public health issues, for instance, the spread of infectious diseases in our prisons, such as tuberculosis, HIV/AIDS. So you can see that it is an interplay with other very important global public health issues. And that is why it is really, really important to have public health reforms, policy reforms on drug use. Okay. So I think that for us in Ghana, not only in Ghana but also in West Africa, usually when people talk about policy reforms, they only talk about the content of the policy. But it is also important to consider the process by which such reforms are made and even the context in which they operate. Because trust me, it's Africa, it's West Africa, but different countries also have their different political context, different cultural content, social context, for instance. And I think that to the Ghanaian people, what we have to do is to make sure we are adapting these policies and implementing, formulating them based on our specific context. That's what I'll say.